Hi sir, how are you?
Doing great, thank you.
Alright, I'm just going to connect some monitors to you before we get started. Okay, pulse off. This is just going to help monitor your heart.
I'm a little bit nervous about today's surgery. First time and all.
I think it would be weird if you weren't nervous, but you're in good hands. We're going to take really good care of you.
I've heard a lot of great things about you. Nurse anesthetist, glad to be in your hands.
This scenario includes an 18-year-old male that is scheduled for right inguinal hernia repair. No known drug allergies with no significant medical history. TNA at 6 years of age with no prior anesthetic complications.
Alright, so you're going to get ready to go to sleep now.
You might feel some pressure on your neck, okay? Ready?
Mm-hmm.
Triggering agents include volatile anesthetics and depolarizing muscle relaxants. It's commonly seen in all ethnic groups, male greater than female, children less than 19, and patients with muscular dystrophies.
Okay, we're in. Confirming placement. End tidal is seen. You can release Craig.
Early signs and symptoms include increase in end-tidal CO2, muscle rigidity, and tachycardia. Anaphylaxis, insufficient anesthesia, and neuroleptic malignant syndrome are among the differential diagnosis.
Is this patient relaxed?
Yeah, he is relaxed.
He's very tight.
I just gave him more paralytic. You know what? I'm going to need you to stop.
Is everything okay with him?
I'm suspecting an MH crisis. Nurse Jackie, activate the MH protocol and grab the MH cart. Gas is going off. Sevoflurane is off. Flows are going all the way up. He's currently hypercardic. I need to hyperventilate him to try and get his CO2 down. He's also tachycardic. Temperature currently is 39.3. Can you initiate the cooling blanket? I need someone to grab ice. Great, let's get that open. I'm going to start placing an A-line so we can send off an ABG.
Management includes notifying the surgeon, stopping the procedure, and discontinuing triggering agents, calling for the MH cart, placing arterial line to monitor vital signs and lab results, inserting a Foley catheter, and cooling measures should be initiated.
Oh, I'm glad you're here. Alright, this is a 70-kilogram patient. I flushed the circuit already. Cooling blanket and ice packs are on. If you could drop 2.5 milligrams per kilogram of dantrolene, he's 70 kilograms, that's 175 milligrams. If you can do that as fast as possible.
I see we have 4 vials here. Nurse Jackie, can we get some 4 additional vials of dantrolene, please?
20 milligram vials of dantrolene should be reconstituted using 60 mL of sterile water, and 5 mL of sterile water should be used for Ryanodex. Both should be administered 2.5 mg per kg rapidly through a large bore IV.
So Dr. Brandon, what's the situation?
I'm glad you're here. I could use an extra set of hands. I flushed the circuit. I sent an ABG off. Ice is on. Patient is cooling. Can you mix up the Ryanodex? He's 70 kilograms. It's 2.5 milligrams per kilogram, so we get 175 milligrams.
All right, so I'll be mixing the Ryanodex here. So we're going to be mixing sterile water into 5 cc's. There's 250 milligrams in our vial, so we'll give 3.5 mLs.
Here are the ABG results.
How do they look?
Dr. Brandon, looks like we're normalizing.
Alright, that's great. His vital signs are returning to baseline. Muscle rigidity is improving. I think we're good to transfer care if you want to call ICU.
Absolutely. Jackie?